Stephen Tucker.
Can you use the microphone?
Oh, yeah. Can you hear? Go ahead, Steve, see if that works.
Testing.
Does that work, John?
Yes, it's fire.
Go ahead.
Yes,
There he goes.
There you go?
Yeah.
Testing 1, 2, 3. Can you hear me?
There.
Can you read? I'm going to touch on 4 things. Hopefully Joe won't cut me off. The first is, from an early age, one of the first things our parents teach us is to do what? To be honest, to be forthright, correct? Always tell the truth. I want you to know that the president is a phenomenal liar.
He's not here. Keep disrespectful.
Probably the greatest liar I've ever seen. And I want you to know how he lied to the American people. It is not an accident you have not seen a health insurance broker interviewed on any mainstream media outlet until 3 weeks ago when I was on Fox News. Until then, there was no health insurance broker interviewed. Great doctors speaking the truth were featured on every channel. Many of them were lined up in white lab coats behind the president in the Rose Garden. Many of them came from the American Medical Association, although less than 17% of the American Medical Association is comprised of actual practicing physicians. But it's less now. And now they're waking up, actually, thanks to great doctors like this who are trying to teach the truth about what's coming in this legislation. But remember when it was first passed, the president said that this is about health care reform. And it wasn't working well for him because people didn't like demonizing doctors and the healthcare industry. So it was much more easier for him to demonize the health insurance industry, the big evil health insurance companies. And so one of the greatest lies he told was the lie about pre-existing conditions. If you remember, before the healthcare legislation passed, the number of uninsured people in this country kept growing and growing and growing. It was 30 million, and it was 40 million, there was 45 million. And then Anthony Weiner said before it passed, it was close to 100 million uninsured people. But when you look at what the U.S. Census Bureau tells us, there's actually half of the 47 million are uninsured for less than 4 months. So you have to take that 47 million number and cut it in half. When you take away the people making $75,000 a year who refuse to buy health insurance, as free citizens, it's their choice not to do so, we end up with a number around $10 million uninsured people who are chronically uninsured. Now, Time magazine told us in 2010 the amount of medical waste we have in our healthcare system in the U.S. is $780 billion a year. Did you know that even if there were 47 million chronically uninsured people in this country, that's $780 billion. If you cut it in half, you could buy every one of them a gold-plated healthcare plan that would make the CEOs of Blue Cross Blue Shield green with envy. So if we can cut costs and pay for these people, then what is the issue really about? What is the healthcare legislation really about? It's really about control. And the president did a beautiful job of blaming the insurance company for pre-existing conditions. I want you to know that it's not the health insurance industry who created pre-existing conditions. There was a law written in 1996 called Federal HIPAA Law. Who knows HIPAA law? Can someone tell me the first thing you hear about when you hear the word HIPAA law? Privacy. That's correct. That is a very small part of federal HIPAA law. A far more important clause in federal HIPAA law, passed in 1996, is portability. And portability ensures that if you are in a group health insurance plan, and you've had 18 months of consistent coverage through a group health insurance plan, through an employer, if you lose that job, if you have less than 63 days between that old job and the new job you get, the new employer has to do what?
Insure you.
They have to insure you. And what do they have to cover from day one?
All pre-existing conditions.
All of your pre-existing conditions. How do we know that? Because when you do lose that job, the former health insurer has to send you what? A certificate of creditable coverage. This entitles the new employer that says, hey, I have cancer. I'm going through heart treatment. My family has a history of medical heart disease. This entitles me that you have to cover my pre-existing conditions because I've had 18 months of continuous coverage. Did you know that that law has protected 90% of the American insured for 16 years? And it's worked beautifully. You know what we have pre-existing conditions? Because when they wrote that law, they extended no portability protection to individual policyholders. I'm talking the backbone of this country, small business owners, mom and dad, mom and pop companies, where they can't group together. They don't have enough employees to go to an insurance company and say, hi, I'm Motorola. My premium I'm bringing to United Healthcare tomorrow is $86,000 a month. Do you want my business or I'll call Humana? See what a group can do? When you're self-employed, you don't have that power. So because of those who wrote 1996 federal HIPAA portability law, extending no protection for pre-existing conditions to individual policyholders, this is why we have pre-existing conditions. Do you know how easy it is to solve pre-existing conditions? You add one sentence to existing HIPAA portability law. The sentence states all individual health insurance plans are now protected under existing HIPAA portability law. And you have eliminated pre-existing conditions in this country forever. Does that take 2,700 pages double space, 960 pages single space? No. Does it even take one page? It takes one sentence. So by demonizing the health insurance industry, Barack Obama successfully swayed the majority of people to supporting this law. When I say the majority of people, I mean the majority of Democrats, because not one Republican supported this legislation. And in fact, they passed it on Christmas Eve, 2009. And they were forced to use the reconciliation process. Has anyone ever looked up the reconciliation process? Did you know in order to use it, in order to pass anything through reconciliation, it must be deficit neutral. It must reduce the deficit, not add $360 billion to the deficit, which is precisely what Obamacare will do. And there's no way that the legislators who passed this in the middle of the night using reconciliation didn't know it was going to add to our deficit, because the CBO in 2009 said it would add $221 billion. And they ignored that. And the only reason it costs $340 billion now, as far as increasing our deficit, is because they had to kill the Class Act, which was the voluntary retirement program, long-term care program, which was underfunded from the beginning. Now, did President Obama just lie about that? I want you to go back to the State of the Union speech in 2009. You know, the one before he insulted our Supreme Court justices. The one before that, where he told the story of a man from Downers Grove, Illinois, right here, who had his health insurance coverage, his treatment delayed, and he died because of it. Please raise your hand if you remember that exact quote from the President. You want to know the truth? Thanks to the Sun-Times, who had an intrepid reporter that said, I wondered if he's telling the truth. Let me go interview Otto Raditz. Let me go interview his sister, who survived him. Let's see what really happened. What happened was Mr. Raditz did not disclose a medical condition he had prior to purchase of his health insurance. And the only time a health insurance company can drop your coverage when you're sick is when you commit insurance fraud, which means you did not disclose something on the application before you bought it. Okay? In fact, the same law, which was passed in '96, that says they can't drop your coverage unless you commit insurance fraud, is the exact same law that was continued right through Obamacare. No changes to it. Now, because he didn't disclose that, the insurance company, Assured Health in Milwaukee, Wisconsin, please Google this story, they sent him a letter saying, we're considering rescinding your coverage, which means you didn't tell us the truth. Had we known the truth, we knew you were sick, we wouldn't have given you coverage. So he called the Department of Insurance. He called the State Attorney General's office. They sent him a letter back stating, we're going to talk to Assured Health Insurance Company, Milwaukee, Wisconsin. Even though we know they're in their legal rights to drop your coverage, even though it was proven you did not disclose your medical history, we're going to ask them to keep your coverage in place. Do you know what the true story is? Assured Health Insurance Company, Milwaukee, Wisconsin, kept his policy in place and paid his claims for 4 more years until he died. And the President is lying again to us. Tom Hanks just finished a beautiful The Road We've Traveled about Barack Obama, right? He's repeating a lie that the President told in 2008 about his mother's health insurance, where she was denied coverage because of pre-existing condition. Did you know that wasn't a health insurance policy? Did you know that was a disability policy? And there is no way the President couldn't know that, because you know who the attorney was who represented Barack Obama's mother throughout the disability case? Barack Obama. So there's no way he didn't know he was lying to us. But I want you to understand why health insurance premiums cost so much, because all of us can agree. I don't care if you're on the left or you're on the right. Did I do that right? Left, right. Maybe you're left, right. I don't care where you are on the political spectrum. Everybody agrees health insurance premiums are too high. I want you to know why. Go back to 1979. Across the entire country, there was a total of 279 mandates placed on health insurance companies, which says, if you operate in this state, you must cover cancer. Simple. The insurance company says, well, what? That's why we're in business, to manage risk. We'll cover cancer. So a total of 279 were placed, and those were medically necessary. Congressman Walsh, I'm a visual guy. I want you to see how many amenities we have now post-Obamacare. We have a total of 2,100 mandates placed on health insurance companies in this country, forced upon them by federal and state regulators. Do you think these are all medically necessary? Why should we be covering hair plugs? Why should that be a mandated expense? And if we paid for Joe Biden, we got ripped off. In vitro fertilization. Did you know that in Illinois, thanks Joe, in Illinois, your premiums are drastically higher because it's mandated that you cover in vitro fertilization. That is not a medically necessary expense. And if you want that, you should be able to purchase that from the health insurance company as a specific rider that you pay more for, not everybody else. Last, and I'll close with this, the war on seniors. Our friends on the left, of which I have none, have been talking about the war on women. I want you to understand something. There is no war on woman or women. It doesn't exist. What's happening is a war on religious freedom. That's what's taking place. Understand that Kathleen Sebelius has been given power to write legislation whenever she wants after this was passed. And in fact, they're comprising this year 15 unelected bureaucrats who will be appointed by the President to staff IPAB, the Independent Payment Advisory Board. Do you understand, and their commission, by the way, is to cut Medicare $500 billion over the first 10 years. All right? Before IPAB was established under Obamacare, we had MedPAC. MedPAC would make decisions, would make recommendations on how we should cut Medicare to keep costs down. MedPAC's recommendations would then be passed on to Congress. Congress would vote on those cuts. So if they were too onerous or too severe, we'd have a safety net. You know why they call it the Independent Payment Advisory Board? Because those cuts, those recommendations, they skip Congress. And if those people who comprise IPAB cannot make those cuts to Medicare, do you know who it falls to? Who makes that cut? Kathleen Sebelius. She makes that cut. And I want you to understand, Paul Ryan said they'll cut $560 billion from Medicare, right? Who's heard that number? Please replace that number with $4.95 trillion. Because according to the chief Medicare actuary, not a right-wing blogger, not a left-wing blogger, not Joe Walsh, the chief Medicare actuary did his study to determine how much Obamacare will cut from Medicare, $4.95 trillion over the first 20 years. Worse than that, it will reduce the reimbursement ratio that government pays to doctors who take Medicare today to less than what it pays to doctors who take Medicaid today. If you're a doctor in this state, when have you last been paid by Medicaid? Right. So, what does that mean? That means that our seniors are in a very perilous situation because according to the American Academy of Cardiology, who did a study in 2005, they tried to determine the survival rate of people who have surgery on Medicaid compared to people who have surgery on health insurance, private health insurance. Did you know the results was that you're 50% more likely to die after that surgery? Because you have no follow-up care, because the doctors aren't being paid. Fast forward 4 years, University of Virginia does a follow-up study in 2009. As of 2009, you're at 97% more likely to die after that surgery than you were in 2005. Compare Medicaid to private health insurance. This is before we add 25 million Americans onto our already bankrupt Medicaid rolls. This legislation is an unmitigated disaster. Thank you.
Let's open this up right away to questions. I'm going to start. This is a quick one for the guys. Some of you have heard this before.